After 2 burnouts in dentistry, I asked myself, what if I could turn my struggles into stepping stones for others? That's how this podcast started. We learn from each other, going from stress to success. And with more than 60% of dental professionals facing stress or burnout, this conversation has never been more important. Let's get started.
But the emojis fix a problem that you're talking about, which is showing emotion.
Yeah.
And what or the other way of looking at it is that people learn through different means. They have a preference, one or the other. Some people like to see movement, kinesthetic they call it. You need to see a visual movement.
Yeah.
Some people are want to see a graphic or an imagery.
What do you prefer?
I have a mix. I can read. I can just read. It's okay for me. Listening is tough. So some people like voice. So some of my friends said to me, "Why? You should listen to this podcast. When I'm walking or going to work, I put this MP3 podcast in." For me, that's difficult.
You wouldn't listen to this podcast?
Okay, but if it's on video,
yeah.
that's different.
Yeah, that's different.
That's the point.
Yeah.
That's why video is so powerful.
Yeah.
Because it covers everything.
Yeah.
It's much easier if I listen to us the dialogue in the car on a podcast. Just the pure voice. Of course, I can do it. It's not an issue. Do I prefer to do that? No. Would I watch us on YouTube or something like this on YouTube? For me, yes, that would be more interesting to do.
The other day I spoke with Alessandro De Vigos. We had a podcast together, and he said that more and more people, I don't know, it was like a high number of people are listening to podcasts nowadays because they're stuck in traffic. So instead of just listening to music, they listen to podcasts. So.
Yeah, I think that it's for me personally.
You're not stuck in traffic because you're like a few meters.
Well, actually, I don't have a car. I made a conscious decision not to have a car. Living in Switzerland, I have an e-bike. And Switzerland has fantastic public transport. So in Switzerland, I don't actually spend much time stuck in traffic because I'm on the bus or on the train. And that's how, or on my e-bike, getting around. So I don't really like driving a car these days. It's okay, but I try because it's not very productive. No. So if I'm on a train or on a bus or not on my e-bike, but I can do work.
Oh, so you're working
while I'm going along. So I pick the type of work that I can do while I'm in the public transport. So I always work. I always plan my time like that.
Yeah.
And of course that's. Talking about stress factors, it's stuck in traffic is a big stress factor for people. So the commute to work every day.
Yeah.
And why is that a stress factor? To an extent, and I think you mentioned this in the practice that you have, when you don't have control or you don't have visibility of when things are going to change.
Yeah.
I've been to Bangkok a few times, many times actually, and the interesting thing there is the traffic's so bad. They have digital indicators of in seconds or minutes of how long you're going to wait before the traffic light changes. So you sit in the car and you watch this thing count down, but it reduces the stress. Because what happens is you don't control. You have some understanding when things are going to change.
Yeah.
And then you can reduce. You can say, okay, I wait for a minute. It's okay. When you don't know whether it's going to be 1 minute or 10 minutes or 20 minutes, then the stress level goes up and up.
Yeah, that's true. That's a big factor in dentistry in other situations. I want to add something here that here the mindset is important, because that's why I liked what Alessandro said there, that you can be stuck in traffic. You have the choice there to feel stressed, or you can see it as an opportunity to learn something new, and listen to a podcast, get inspired by others.
Yeah.
So you can in 1 second, just change that mindset.
You can
in
take a
that
positive,
situation.
in that situation.
But it is true that, can I think the same way in a dental clinic?
Well, let's say we talk about the email thing. You've sent an email out to reschedule, but you don't know when they're going to come back to you. So it's open-ended, right?
Yeah.
So are they going to reply in 5 minutes, or are they going to reply in a day?
Yeah.
What do I do when that slot they've asked for, that may be free, is somebody else wants to take it?
Yeah. It's frustrating, and it's frustrating for the receptionist. And here I want to take the opportunity to give a shout out to all the receptionists out there. We were speaking about that yesterday, that they are sitting with all these. They are the ones who hear the complaints. They are dealing with all this puzzle work, and many times they don't think that they feel appreciated, because it's abstract. You can't really count it, see it, or maybe
yes, that's
you
true.
can count, but nobody really sees all these.
So for them, whether, and even if you're on the front desk as a dentist, the communication with the patient as a dentist, they will tend to be, let's say, they may not express their frustration as strongly as when they're at the reception.
Yeah.
So they tend to filter or be a bit more careful, in my experience, with the dentist conversation than if they're unhappy or really upset about something, they might let go at the reception.
Yeah.
And of course, if you have a waiting room of 2 or 3 people, and at the reception that the person is expressing their dissatisfaction about something, then the reception team that are there are having to deal with that, real time, and it's not easy. And a classic, I think we discussed this as well yesterday, around competing demands. Let's say you have a WhatsApp, going back to that, where the message is coming from the patient. They're expecting you to be available on WhatsApp to talk, while there's somebody in the reception waiting for their appointment that you may need to give a medical history form, anamnesis form, for them to fill out. So you've got this competing demands, and for the reception team, that creates another stress factor.
A lot.
Because
I always say that the policy.
Which do they prioritise?
Yeah, I always said that the policy is that we should prioritize the patients that are in the clinic.
Yeah.
They are there. They took their time to go there.
And I think that's generally a good policy, right?
But of course, it's so important to take care of the other things as well, as soon as you don't. So they're juggling between the people that are not there, that will come, that have been there, and that are there. Right.
So part of patient relations, and if you do this digitally well, is that it's this managing expectations part. As we discussed, there are unrealistic expectations for patients. Right? We've seen this with. I've been involved in cases myself where a particular patient is unhappy about their cosmetic, maybe veneers result, and of course, the whole procedure and the treatment planning and all the effort that went into this, to have a patient at the end that is not happy, is dissatisfied. It wasn't what they expected or what they thought they would get. And I always, but of course patients could be unrealistic. I can imagine, and I think you said this one time about one of your patients, but imagine you have a lady come in and say, with a picture of Julia Roberts, says, "I want that smile," right? Yeah. Now, Julia Roberts' smile, with her lips and the width of her mouth, I mean, I suppose that would be a real challenge, right?
Yeah. You would have to do a surgery with the lips and everything. So.
But for them, they say, "Well, I see this photo. I want to be like that, and can you should be able to do this. I'm going to pay you." And then that's the other issue. Yeah. What they think they going to pay versus what they can afford is a different thing.
What advice would you give to the dentist in these situations?
Well, there are 3 questions typically that you need to ask, the open questions that you would typically need to ask the patient, or as early as possible get this information out of them. And I think the first one is, you know,
What's your budget?
not I wouldn't start with that one.
Are we going
You always
for the
leave,
porch?
always leave the money to the end. It's always the harder one, right? So one of the first things you say is, what would your smile? What do you think your smile should look like? What are you expecting? If it's cosmetic, let's stay on the cosmetic theme.
Yeah.
At the end of the treatment outcome, how would you like to look? And of course, they might pick that photo of Julia Roberts. And at this point, you have to be honest and say, I think that's going to be difficult. Okay. And then the next question they will ask you is, what is, you need to get from them is, how much time have they got? Can they invest all the steps depending on the level of the treatment plan?
That was I will just add this. That was another stress factor that I told you about. That we had a lot of patients that were tourists, so they had just 1 week.
Yeah.
So then suddenly you had to prioritize this patient and make sure that Monday you do all the preparations and you have to finish the work on the Friday. And the stress factor is that you need, if you have a technician, you need a technician to have the work ready.
Yeah.
So there we have again a lot of things that are out of your control.
Yeah.
But that's why also more and more dentists and dental clinics start to make their own crowns. So they want to have the whole control at the clinic.
At the clinic, yeah. So of course, if in a dental tourist situation, we're working with one client of ours at Smylor right now and helping them with all on four and veneers and a couple of other cosmetic treatments. And they have, obviously they've worked out this, what you just discussed is, how can we do this in the least amount of trips for the patient? And we've spent time with them helping them get their messaging right to set the expectation of the patient. And one of the expectations that we often we get is, well, and this is a challenge. If you look at a standard treatment, let's say for an implant or a crown, or maybe it's veneers, without any complications or any problems, you might have a treatment plan with the minimal, you minimize the time that they have to be, and it's the most cost effective, right?
Yeah.
So you say, so of course it's a simple thing. We know this when we buy a car, we don't necessarily buy a car with all the options. From a price point of view, we might look at a car and say, and then we'll see the price, and it might say from €30,000. It doesn't mean I'm paying €30,000. It's just at 30,000 and above. And I know as a consumer that if I'm going to add leather seats and air conditioning and all the other features that you could put in, then that price might be, it depends on the car. If it's a German car, it might double. We don't know. But you have this situation where you understand from.
Yeah.
It doesn't mean it's a commitment from the dentist to make that. So the expectation management is important, that on the pricing part, you get a balance between setting the expectation in the patient of what's the type of budget. Is it affordable for them? That's the last question. You asked about what's your budget. Yeah. Okay. I think
so that's something that you recommend, that the dental clinics should have prices on their website, or should announce from.
I would recommend they look at, even if they don't publish it on the website, as early as possible with the engagement, that you give them visibility of the price. So let's say they booked an appointment with you for a consultation on implant. The communication that confirms the appointment should, and you can do this digitally, we do. So when the appointment's booked and we know it's that type of treatment, you can easily give a simple text that says, our implant treatments are from this price. And what that does is you give a personalized, you already setting the expectation early of what the type of budget should be. So that.
But it could be from 1,500 to 5,000.
Then you can put that.
So you have like
you can write that. You could say our typical implant, depending on your situation, is from this to this.
Yeah, because that's why I think that many dentists don't put it, or dental clinics, because we are so afraid of putting ourselves in a situation where we cannot go out, because it depends on so many different things and combinations.
Well, you asked about the website. What's the reason to put on the website? It depends a little bit on the type of target patients that you want and so forth. But generally speaking, if I go to a website and I see it talks about consulting or a service level thing and they don't include prices, then in my head I go, that's expensive. I'm gonna take, it's gonna take me time to find out how much it's gonna cost me and what's gonna go through. Am I willing to invest the time to go through with the person on the phone who has been maybe taught never to give the price, and go through maybe a proposal and discussion and so on to find out I can't afford it.
Yeah.
And in the end, that's in digital relations, and for you to move on, because you have there's this volume thing, is you're better getting an understanding or getting across to the patient, what type of payment terms you can offer, because it's not just about the price, it's not just about the cost of the whole treatment. In their mind, it's can I afford it? And that what that comes down to is, if I have a monthly salary of, let's say, €2,000 a month and of that €2,000 a month, a certain percentage goes on my rent, a certain percentage goes on my food, so on. What do I have left in the month to spend on a set of veneers that I'm really desperate for, because I want to feel confident with my smile? And normally that will never be enough to cover the whole treatment cost. So what we recommend for dentist practices is that you should really look at affordability and payment plans and things like this for the higher value treatments, because then it takes the stress out of the conversation on the money. Because if it becomes affordable, and that's a big, you reduce the factor as well. So you don't feel at the end of it. You say, well, okay, if you want to pay, we could do 3 payment items, starting, middle, and end of the treatment plan, which some practices do. Or you could say, if that's too much for you, we have this provider that can, with a payment plan, that can do it over 24 months, or 10 months, and then then the patient goes, oh, fantastic! So I now can actually get my treatment because I can actually afford it as well. And then your relationship jumps up. It's not necessarily about being expensive. It's about, is it affordable?
Yes.
I wish I had a Smylor when I had my dental practice. It removes so much stress from the dental team, handling online bookings, patient questions with a chatbot, pre- and post-treatment automations, and even offering a marketplace for dental treatments. Smylor isn't just a sponsor, it's a solution. That's why I love working with them, because they take dental teams from stress to success. If this episode helped you, don't keep it to yourself. Like, comment, and subscribe. Not for the algorithm, but to help more dental professionals go from stress to success. Your support means the world. See you next time.